Hello, my name is Ashley Lowry. I'm an Indiana State University nursing student, and the topic of my presentation is cultural respect and influences on healthcare. So, who is at risk? The population at risk are individuals with diverse values, beliefs, and behaviors. Here are the following learning objectives for the presentation. I've included a pretest to check your knowledge on the topic. Don't worry, everything will be covered in the presentation and answers will be provided at the end. So, what is culture? Culture encompasses the social behaviors and norms found throughout human societies, as well as the knowledge, beliefs, customs, laws, arts, capabilities, and habits of the individuals in these societies. It's a set of established beliefs that are held by a certain group of people that have been handed down from generation to generation, and they're not held or shared by other groups or members of other groups. Cultures are beliefs, values, and perceptions, and they're unique to a particular culture, and culture is dynamic and evolving. In healthcare, it's important to put forth the extra effort when understanding culture. Being culturally aware is when you know that there are different identities that exist and they may impact your practice. Cultural competency is understanding how different identities might impact your practice, and you begin to try to accommodate them. Cultural respect is being open, not making judgments or assumptions, and putting competency into practice. It's understanding that a variety of experiences, expectations, and identities, and how they will impact your work. Cultural respect is important and can help improve outcomes. By developing a strong level of respect and trust with your patient and being more patient-centered, they'll feel more comfortable communicating social and physical problems that are affecting their health. Gaining an understanding of their culture and background can also help the provider build an optimal plan for overcoming barriers to improve health. Cultural respect can also help reduce inequalities. Minority communities often have trouble accessing comprehensive care. However, healthcare providers can ensure that these communities have access to the best care possible by having a culturally respectful healthcare practice. So, who deserves respect? Everyone deserves respect. Each individual has differences and they deserve to be respected. There's no certainty for which community a patient identifies with just by looking at them. This is why cultural respect plays a critical role in healthcare. When it comes to cultural assessment and culturally oriented care, the nurse must integrate cultural needs and beliefs into their practice to provide care that is individualized for the patient and appropriate to the patient's needs. During the assessment phase of the nursing process, the nurse assesses the patient's and family members' cultural background, preferences, and needs. The nurse will then modify the plan of care accordingly. The cultural assessment and culturally oriented care enables the nurse to identify ways in which the patient's culture impacts their perceptions, beliefs, values, experiences with health, wellness, illness, suffering, and death, remain accepting, respectful, and welcoming of human diversity, facilitate more holistic assessments and plans of care that are based on patient's culture, deepen and strengthen their commitment to nursing and their insight into the nursing profession as based on culturally based nurse-patient relationships, integrate their full and in-depth cultural knowledge into the treatment of patients, and develop and integrate open-mindedness into nursing care. I've included the ANA Code of Ethics for nurses because it is essential that we uphold and maintain the Code of Ethics in the nursing profession. Culture can impact healthcare in a number of ways. Here are some examples. How patients and healthcare providers view health and illness, what patients and healthcare providers believe about the causes of disease, which diseases or conditions are stigmatized and why. An example of this is in many cultures, depression is common stigma, and seeing a psychiatrist means the person is crazy. What types of health promotion activities are practiced, recommended, or ensured? In some cultures, being strong means having a store of energy against deprivation, and strong women are desirable and healthy, whereas in some Canadian cultures, strong is considered to be overweight. and how illness and pain are experienced and expressed. In some cultures, stoicism is the norm. In other cultures, people can openly express painful feelings, and the degree to which pain should be investigated or treated may differ. Where patients request help, how they ask for help, and when they make their first attempt for care. Some cultures actually prefer to consult with an allied healthcare provider first and save a visit to the doctor for when the problem worsens. Patient interaction with healthcare providers. Not making direct eye contact is a sign of respect in many cultures, but a care provider may wonder if the same behavior means their patient is depressed. Also, the degree of understanding and compliance with treatment options that are recommended by healthcare providers who don't share their cultural beliefs. Some patients may believe that a physician who doesn't give an injection may not be taking their symptoms seriously. And how patients and providers perceive chronic disease and various treatment options. Some other examples of how culture can impact healthcare include the acceptance of a diagnosis. This includes who should be told, when, and how. Acceptance of preventive or health promotion measures such as vaccines, prenatal care, birth control, screening tests, etc. Perception of the amount of control that individuals have in preventing and controlling disease. Perceptions of death, dying, and who should be involved. The use of direct or indirect communication. Making or avoiding eye contact can be viewed as rude or polite depending on the culture. The willingness to discuss symptoms with a healthcare provider or with an interpreter. Influence of family dynamics, including traditional gender roles, familial responsibilities, and patterns of support between family members. Perceptions of youth and aging, and also how accessible the health system is and how well it operates. When incorporating cultural practices and beliefs, it's important to avoid generalizing and making assumptions. Never make assumptions about a patient's sexuality, ability, gender, education, income, or anything else for that matter. Be sure to ask open-ended questions. And even if you know a person's identity, do not assume that you know right away how they interact with that identity. Remember that everyone is different. Don't judge. If the patient or the patient's family feels comfortable enough to share their experiences with you, make sure you don't jeopardize this by carelessly making them feel self-conscious or ashamed about their identity. And be mindful with your comments about other identities. Even if you know that your patient doesn't identify this way, if you make a comment that doesn't embrace one identity, they may not feel confident that you will embrace theirs. Ensure that the language that you use is inclusive of a wide variety of identities, abilities, and sexualities. Use and reinforce the language that the person uses to talk about themselves. And remember that any pieces of a person's identity is only that. It's just one piece of a broader identity. Also try the teach-back method. Start by having the patient explain to you what they expect or understand about their condition. You'll be better equipped to meet them where they are, respecting that space, and then developing on it. Even outside the cultural respect context, the Department of Health and Human Services says that the teach-back method can actually improve patient compliance and satisfaction and decrease callbacks and canceled appointments. It's also important to avoid cultural bias. If you suspect that an interaction has been adversely affected by cultural bias, either by you or the patient or their family, ask for help. Respect, understand, and welcome differing cultural perceptions of effective or appropriate treatment. Ask how your patients and their families prefer to receive healthcare and treatment information. If needed, arrange for an appropriate interpreter. Listen carefully to your patients and confirm that you understand their concerns and needs. Make sure you understand how the patient understands their health or illness. Recognize that families may use complementary and alternative therapies. Negotiate a treatment plan based on shared understanding and agreement. Find out if the patient or family would benefit from spoken or visual messaging for reasons of cultural or limited literacy. Here are the answers to the pretest. Let's see how you did. Here are some additional resources.